Hi everyone. Today in this video let us discuss Halobetasol propionate. What is this drug Halobetasol? The suffix sol indicates that this drug is one of the topical corticosteroid. This drug is available in the ester form as propionate. So Halobetasol propionate is one of the topical corticosteroid. Among the corticosteroids, we have different types of drugs which are classified as highly potent, medium potent and mild potent. But Halobetasol propionate is classified as super potent steroid. So this drug is very potent. That's why it is not indicated for the children. In the adults with age greater than 18 years only, this Halobetasol propionate is used as topical corticosteroid. So any exposure of this drug to the children produce systemic toxicity. That's why its contact should be completely avoided with the children. And this drug is indicated for the treatment of plaque psoriasis, where it can produce anti-inflammatory effect, thereby it can reduce the plaque formation. And this drug is available in different dosage forms as ointment, cream, even it is available as lotion, as well as foam. All these are intended for topical purpose. And they should be applied on the affected area on the skin, but they should not be applied to the eye, because on the eye, Halobetasol can produce few of the ophthalmic side effects. Being a corticosteroid, this drug can increase the risk of glaucoma and cataracts. That's why this drug should not be applied to the eye. Similarly, this drug should not be applied to the groin area, axillae, underarms, as this drug further increases the skin irritation and local reactions. So this drug is mainly indicated for plaque psoriasis by topical route in the adults with age greater than 18 years. Now let us see the precautions of this drug. One of the important precautions is that Halobetasol is indicated for topical purpose. But when this drug is applied topically, few of the drug molecules may enter into the systemic circulation. So this systemic absorption may suppress the HP axis, hypothalamus pituitary adrenal axis. By suppression of this axis, the cortisol is somewhat less released from the adrenal gland, which results in the symptoms such as Cushing syndrome. So by suppression of HP axis, we can observe the symptoms of Cushing syndrome in the patients. The patient may have increased weight gain. Some reddening of the face can be observed. Blood pressure may be increased, resulting in the hypertension. Blood sugar levels are increased, resulting in the hyperglycemia. Even glucose is more excreted within the urine, resulting in the glucoseuria. All these symptoms can be observed by suppression of HP axis. That's why the systemic exposure of this drug should be minimized, which can be achieved by for short-term use of this drug. So Halobetasol propionate should be used only for 2 weeks. When it is used for more than 2 weeks, it can increase the systemic exposure, resulting in the suppression of HP axis. Another important precaution is that this drug should be applied on the skin, but it should not be covered with occlusive dressings. So bandages and occlusive dressings should not be applied, as they further increase the contact with the skin, which increases systemic absorption. So generally, Halobetasol propionate should be applied on the intact skin. Similarly, this drug can produce some local skin reactions, resulting in various symptoms such as skin irritation, striae formation, skin atrophy, thinning of the skin, even acne-type eruptions, hypopigmentation. All these are possible with the Halobetasol propionate. Now let us see the side effects of this drug. Halobetasol mainly produces local skin reactions. It can produce some headache, dryness of the skin, skin atrophy, thinning of the skin, burning sensation, skin irritation, widening of small blood vessels, which is more important when this drug is applied frequently for 2 weeks, which results in the thinning of the skin, and it can also produce some stinging sensation, and finally it can produce some contact dermatitis. Now let us see how this drug acts. Halobetasol propionate can act on the glucocorticoid receptors. These glucocorticoid receptors are present within the cytoplasm. They are coupled with one of the protein HSP90, heat shock protein 90. Now when Halobetasol binds to these glucocorticoid receptors, this heat shock protein is removed and glucocorticoid receptors are internalized, where they can undergo dimerization. So after dimerization, they can produce gene transcription, resulting in the production of mRNA. Now this mRNA can guide the protein synthesis at the ribosome, where the proteins are going to be synthesized, such as lipocortin 1 and annexin A1. These are the proteins which can reduce the inflammatory cascade, thereby they can reduce the inflammation within the cells. Similarly, if you have the inflammatory mediators can act on these cells, when they bind to their corresponding receptors, they can activate one of the pathway, NFKB, nuclear factor kappa B. Now this nuclear factor kappa B can again interact with the DNA, where it can produce gene transcription, resulting in the release of various inflammatory mediators. These mediators can produce inflammation, which is again controlled by halobetasol propionate. Now this halobetasol propionate can inhibit the NFKB pathway so that it can reduce the release of inflammatory mediators. Even this drug can reduce release of prostaglandins by increase the activity of annexin A1. This annexin A1 can inhibit the activity of phospholipase A2, thereby it can inhibit the release of prostaglandins. By all these actions, halobetasol propionate can reduce the inflammatory response. How it is given? This drug is available as ointment, lotion, as well as foam. All these are available at a strength of 0.05%. At this concentration, this drug should be applied twice daily on the affected area. But the treatment should be continued up to 2 weeks. For more than 2 weeks, this drug is not recommended, as it can suppress the HPA axis. So that's about this drug halobetasol propionate, which is a topical corticosteroid indicated for the treatment of plaque psoriasis. Being a super potent corticosteroid, this drug should be used in the adults with age greater than 18 years. And this drug should be applied twice daily for maximum 2 weeks. And the weekly dose should be less than 50 gram in order to minimize the systemic exposure. This drug can produce suppression of HPA axis by systemic absorption, which can produce the symptoms such as Cushing syndrome. With that precaution, this drug can be applied topically for the treatment of plaque psoriasis. So that's about this drug halobetasol propionate. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.